two things. One is shorter and not very complex, but our one of our taglines is redefining the modern landscape of nursing,
Mhm.
and I feel like you know like we're giving our care in all of these conversations that we're doing, which is a different way of providing care for people. And I see that in I see like your passion and your vision for helping young nurses is redefining caregiving.
Hi, I'm Julie.
And I'm Caleb. Welcome to Nursing You, the podcast where we redefine nursing in today's healthcare landscape. Join Julie and I as we step outside the box on an unconventional healing journey.
Together, we're diving deep into the heart of nursing, exploring the intricate relationships between caregivers and patients with sincerity and depth.
Our mission is to create an open and collaborative experience where learning is expansive and fun.
From the psychological impacts of nursing to the larger implications on the healthcare system, we're sparking conversations that lead to healing and innovation.
We have serious experience and we won't pull our punches, but we'll also weave in some humor along the way because we all know laughter is often the best medicine.
It is. And we won't shy away from any topic, taboo or not. From violence and drugs to family and love, we're tackling it all.
Our nursing knowledge is our base, but we will be bringing insights from philosophy, religion, science, and art to deepen our understanding of the human experience.
So whether you're a nurse, a healthcare professional, or just someone curious about the world of caregiving, this podcast is for you.
One last thing, a quick disclaimer before we dive in. While we're both registered nurses, nothing we discuss here should be taken as medical advice. Always consult with your doctor or a qualified healthcare provider for any medical concerns you may have. The views expressed here are our own and don't necessarily reflect those of our employers or licensing bodies.
So let's get started on this journey together. Welcome to Nursing You, where every conversation leads to a healthier world.
Like you're perfectly aligned with what we're doing. It's awesome.
Yeah.
So bravo.
I love it.
Yeah.
Yeah.
The other thing that kind of has come up a couple of times through the conversation is the general mistrust of the public of healthcare. That COVID, especially, it really divided society into, people who I trust science. Like you can't trust science. Like science is a method. It's
right.
not,
you need to trust well-defined quantitative or qualitative results that have been replicated many times. That's when we get to the trusted phase, not in phase one.
Right. And so people landed either I trust science, which is kind of a misnomer in my mind because it's a method. And then on the other side, the fundamental distrust of, because all these systems are so siloed. When you guys were talking about, when you're talking through like all of the different processes of administration, even the CEO has really no final say.
Yep.
They are answering to someone else. Like everyone's answering to someone else. So everything is kind of disjointed and nothing can change.
Of course.
And I think that I've had people tell me they would rather die than go into a hospital because they don't trust it.
Mm-hmm.
And, of course, when that statement actually, when the rubber actually hits the road and they're in a crisis, of course, they're going to go.
They're there. Yeah.
But what I'm talking about is the fundamental mistrust. And to me, it seems like, we've been kind of in a mini series. I don't know if you've gotten to the last 3 episodes, which are talking kind of through left brain, right brain functions. And to me, all of this stuff that we're describing is very, very right brain, reason, logic, structure, and no creative left brain. I think I've got those right. I think
opposite. Yeah.
Yeah.
Left brain, critical thinking, right brain, creative. Yeah.
Okay. So, how do we I think the question that I'm getting to is how can we get shift it from that fully reasoned logic? Like, because we are doing the dance. We are in that space. Like we've talked about when we're in a critical situation and you use humor to break
Of
the
course.
ice, and then everything, all of the logic is restored, and the crisis is kind of, the tension has been broken, so you can move forward in a meaningful way. Like
So
how do we?
look at there's some current theories going on in education about how we have education has piled so many things onto educators, and I'm talking primarily your pre-K through fifth grade educators at this point, and they've started looking at middle school a little bit, but what we're currently talking about is these grade school guys. We have put so many kids in the classroom because we have more kids, not enough educators, not enough resources, right? Sounds very similar to nursing. And we have removed the educator's ability to change assignments, to create things, to be creative and find those new ways to teach their students.
Mhm.
And they're starting to see educators leave in droves like nurses have because they're only at survival now.
Yeah.
The difference being they started in a world that was built and fostered their creativity. We unfortunately did not, because when we got into it, the system was already set up and it runs the way it is. But
I mean, there was still some creativity in this. Like our hands weren't tied when it came to patient care. The objective was caring for the patient. Now the objective is I have to have my IVs documented at the documentation of the process that I've just performed is more important than performing the process.
Yeah.
Performing the
and
action.
that's the invent of the EHR, because it was, if you look at the history of the EHR, it's set up as a billing program first.
Yeah.
And every single one of those checks that you click has a code tied to it, that has a charge tied to it, that a billing and coding person no longer has to read a chart and pull all of those out. It's done automatically.
Yeah.
Wow. Yeah.
So that's where the EHR come from. It wasn't for us. It wasn't for charting.
Right.
And instead of hiring a billing encoder who can go through that chart and kind of find some of the nuances, that weight was put on the nurse. Now, instead of clicking 3 check boxes, I need you to click that you put a 20 gauge, you put it in the right forearm, that you got flash, that it flushed well, that the patient tolerated, that you put a clear transparent dressing on it, that you put a J-loop on it, that you taped it down, that you did just all like the check boxes instead of 20 gauge IV right forearm, which is what we used to write,
Right.
became 47 clicks.
Yeah.
And so again, that's more stuff gets sit on the nurse and taken away, because we don't have billing encoders like we used to.
Right.
It's a different process than it used to be. So why would we pay nurses and billing encoders when I can just make the nurse do it by making her use this electronic health record? And then I only have to pay the nurse and I don't have to pay the billing encoder. And voila, I've saved $40,000 a year or whatever the salary.
Right.
So take us back to the educational system. I kind of interrupted. Like I do feel like there was a more creative process or more free process of providing critical nursing care in the emergency room, in the ICU. It was just more free. And that statement came up from what you were saying about the hands of teachers being tied. So
And so they're experiencing the same thing. So, most of them used to have a planning period, and most of them used to have like a return week, and most of them used to have support, resources, and all of those things over time are just being dwindled, very much like nursing resources are just being dwindled, and more sits on that teacher. And so now she is only on the logical, how do I logistically get things done, and not thinking about how can I creatively teach these students to learn what they need to learn. And we see this reflected in, well, I think standardized exams are, that's a whole nother podcast, but we see this reflected in knowledge that our students currently have when they graduate.
Yeah.
Because everybody just survives. Everybody passes. Everybody, like my child's school right now, if she did not one single bit of work, she would get a 50%. She would not fail with a 0.
Right.
She would get 50%.
Wow.
And so we are just compensating and compensating and pushing and pushing and pushing and pushing. And we are removing that creativity so that every student learns instead of just the ones that learn this way.
Yeah.
Right? We're
Right.
one approach, and we're hoping that all 40 of those students in the classroom can learn from that one approach.
Yeah.
And common sense would tell me it doesn't work like that because those 40 kids aren't the same.
Yeah.
I mean, I just heard someone say recently that they anticipate teachers to really just be, overseeing AI. That the AI will be replacing teachers sooner. Like that's one of the first venues for AI to really knock jobs down. Is that the teachers will just be there supervising children, whereas the actual educational apparatus will be executed by AI.
Well, if you think logically about it, if we use Google Classroom and we use Chromebooks and we integrate all of this technology, and if all of the lessons and the PowerPoints and all of those things are put online, and the teacher is not going to actually tailor the lecture to the 40 students she has in front of her, why couldn't it?
Mhm.
My question then becomes, what's the product result of that?
Yeah.
Yeah.
And it's exactly what we have now. We have order set nurses who go down the list and follow the things, whether they make sense or not, whether they're applicable to their patient or not. We're going to end up with students who do the things they need to do to get the piece of paper they get, and they're not going to have the knowledge that we are assuming they have.
Mhm.
Yeah.
If you graduated high school. If you graduate high school, I assume you have X amount of knowledge. You're not going to have that because you just went through the motions and there was nobody who inspired you or held you accountable or who was creative in figuring out that, I don't learn by listening to you.
Yeah.
You can yak at me all day long. But if you want to throw me into it and let me do it, then I probably can catch on pretty quick.
Mhm.
So AI is going to replace all of that stuff, and we're going to see a net product loss, I think, because they're coming at it with the goal of replacing the teachers instead of, can I take away some of those mundane, routine, logical tasks that give them the time and space to then be creative with what they're doing to engage students so that they learn.
Yeah, that would be the best. I mean, because AI can be adaptive, and I think there are a lot of positive aspects to it, and it can bring a lot of, I don't know, elements, whatever you want to say to it, but getting those tasks off the teacher would allow her to use her creativity and make sure that this type of AI was working for this kid, or maybe he needed to do this, or maybe he needs more hands-on this, and she more of like an overseer to adapt the adaption, the adaptive AI, that she would be able to oversee that using those modalities.
The people who are making these decisions are not looking at it. One of your episodes talked about the qualitative value that a nurse brings, and it can't be measured.
It can't be measured.
There's some qualitative researchers out there that say that we could get pretty close to the value of that. The astronomical undertaking that would be that's probably where your impossibility lies. Not that you couldn't get to a number or a value.
You could. Have you ever read about Brene Brown and how she has done a lot of research on emotions and things like that? So I believe that you could get there, like you're saying.
Technically,
you would be
could.
Technically you could. It would be huge.
It would be astronomical.
Yeah.
And that's where your impossibility lies.
Yeah.
So if we're looking at those things that can't have a value, but the people who do those jobs, i.e. nurses and i.e. teachers, we know there is a significant value attached to that. But the people who are making these decisions are not doing the job. It is expense, profit.
Yes.
And AI costs me this much, and Professor Falconer costs me this much. They're not considering the value that doesn't have a number attached to it because it cannot go on their spreadsheet.
Right.
So those people who are making those decisions aren't considering that, nor are they considering anything past the budget. They're not considering the sequelae that are going to come when we remove that educator and replace it with AI. What's my product on the outside going to look like? Nor do
Mhm.
they care. Their job is that Excel budget sheet, and that's it.
Yeah.
And that's the problem. People
Yeah.
who make these decisions in education or healthcare are not required to care as long as it balances and there's this many in P and profit and this much in loss. Like that's it.
I mean,
Well,
I just I push back on the idea that they don't care. Like I think that there's I think that I think
maybe
there
they're not allowed to
absolutely
care.
there are for sure malicious people out there. Absolutely, there's no question about it. But I don't think so many are intentionally disregarding.
I don't think it's disregard. I
It's
don't.
not, I don't think it's disregard, and I don't think it's that they don't necessarily care,
Uh-huh.
but everyone is smart enough to know that if my job is to manage the P&L on this spreadsheet, and that's the requirement, and I start pushing back and I start stepping out of that boundary, say, yeah, I would like the losses to be a little bit less, but we need to consider all of these qualitative factors that occur. What is the system going to do to them? Pull them out and replace them with somebody who will do it. So their survival isn't necessarily that they don't care, but
Mhm,
their paycheck, their families, their ability to take care of their kids
mhm.
means that they're in this box.
Yeah.
And I
So
think
they can get
that's
hurt
hurting
more.
them. Yeah, I don't think it's really that they actually don't care or that they're trying to be malicious. I think that they are also in a box, in a
Mhm.
constraint, and that's part of their job, just like nurses. It's part of their job to manage that loss versus, reward or P&L, all of that. And
Mhm.
I think that they are also their hands are tied. And
Correct.
so you will, and we never mean everyone always, always
Of
Mhm.
never.
course.
We don't ever always mean that.
That doesn't
We
exist.
no,
Always and never don't
there
exist.
are
Right,
lots and lots of managers who try
Mhm.
and who make it seem like to the nurses, to the people on the floor, to the staff. I was one of them that you because I did care. I do care.
Mhm.
But
Mhm.
the you have to be very crafty to
Mhm.
exude that to your people and abide by the rules of your job, which is
Correct.
you better make money or
Correct.
don't spend so
Uh-huh.
much. You
Yeah.
actually have nothing to spend. So,
Yeah.
or we're not hiring anymore. So make do with what you have. And
Mhm.
I or a manager or whatever has to take that and not make the people who work for them think that's what's going on. They have to have a piece of I don't care because otherwise they couldn't do the job. Like me. I
Mhm.
couldn't take the care out of it because I cared way too much. There are managers who they do care, but yet behind the scenes, they are doing things or won't allow certain things because they are going to keep their job and they
Because
are
they
going to
can't. They're put in a system that is designed
yes,
or meant
exactly.
to
Yes,
keep them navigating the way they are to navigate. And
right.
it's not that if you went to any unit manager in throw a dart, pick a hospital, pick a
Yeah,
unit, you could go to that manager and you could say, if I could give you unlimited staffing, unlimited help, you got it. There's none of them that are going to be like, no, I'll turn it
yeah,
down. I'll take the profit.
Right, right,
None
right.
of them
right,
are going to make that
right.
decision.
Yeah,
Yeah.
But in turn, it becomes you're put here. And so I guess when we look at P&L, the people that are making the decisions, they're in the exact same boat we are.
yeah.
So
Which
it's
kind
not
of takes me back to the question of how do we get it moving in a direction where there's proper communication? I mean, I don't
can you get it moving in a direction without breaking it?
yeah, I don't know. I don't know.
'Cause I mean, you just go all the way to the top of the pyramid and that. It's the 2 playing golf, making
Mhm.
decisions as
Uh-huh.
to what hospital or what insurance companies they're gonna use or how much whatever. I mean, or how out of the box can you think to try to get more out of Medicare or get more reimbursement or have more problems or, all of that. It's sick when you really think about it because when you really are the nurse at the bedside, a human taking care of another human, it's very hard to even allow our minds to think that it might actually be that way.
Right.
Because it's
It makes
just
it hard to do the job.
yeah. Yeah.
An unfortunate reality. And so I would say that for me, that's what made me decide I can't fix this system.
Yeah.
Mhm.
There is no power that I can gain, no credential, no fancy education, there is nothing available out there for me to obtain that changes this system.
Yeah.
Mhm.
Unless I've got like some healthcare conglomerate long lost uncle that I don't know about and he's going to leave it to me. Like,
Yeah.
that's probably the closest to a real possibility I got. So, the only other way that I've seen that is effective is I have to change the people that are working in it. And if
Mhm.
the nursing workforce is 3 million people, give or take, and 2.6 of these 3 million people are unwilling to work at your facility because this one does it better or this one does it better, then it's just like everything else, supply and
Yeah.
demand.
Yeah.
It will change,
Yeah.
but
Mhm.
we have to be okay demanding it first.
Right.
We have to see the value in demanding it first
Yeah.
and not just take ownership of anything that happens is a failure on my part, as if
Right.
you have any control
Right.
over any of it.
Right, right, right.
All responsibility, no authority. And that's
Yeah.
what
Right.
we got to remember here. And so
Yeah.
I don't
And
know
so
how else to change it without the
Mhm.
system breaking itself. And I
yeah.
truly thought there for a little bit maybe COVID was going to do that,
Mm.
was going to highlight and do that. And that bubble was wildly popped when it went right back to status quo, if
Yeah, it
not
really
worse
did.
than status quo.
Uh-huh.
Yeah. If
Mhm.
anything, it's worse.
Yeah.
Yeah.
Yeah. Yeah.
And so
I
I'm
mean, and I think, I feel like we're doing pretty much the same thing, which is
Mhm.
educating people to know that it's not their fault, that they're not the failure,
Yep.
Right.
that you need to be in a mental place, healthy
Mhm.
and knowledgeable to know and you know that you're choosing to do that. It's not being done to you, so therefore you do get to choose where you work, you do get to choose what unit
Yes.
you're on, you do have a choice. And so education, and then just helping people understand their value, that you're not just in a system and you're not just in a cattle being, you are a nurse, you're very smart, you have feelings, it all means something. Yes, are you crying at work? That means something. Do you come home and you yell at you kids or all you want to do is sleep? That means something,
Mhm.
and so you're kind of preparing the people who are coming into the field, and we want to help with that, but also then educate people who are already in the field who feel like they are helpless, who
Mhm.
feel
Yes.
like there is nothing, and so they quit, which
Mhm.
we don't need everybody to quit either. We just need to figure out how to help the ones that are already in it to try and just have a different perception of it, so that
It's
they so that we can continue to make these small changes.
and so when either one of you went to nursing school, you were taught how to be a nurse,
Mhm.
right? We were all taught how to be a nurse. Did anybody have any education on how to deal with being a nurse?
Right. No. The answer
Yeah.
is
That's what we're doing. I mean, that
Yeah.
is what we're doing.
And
Um,
this is where we're at now, is
yeah.
there is no other way.
yeah, it's not just the skills, it's how to navigate this healthcare system that is here. And like I said, our lifetime, it's not going to change. There might be small things and
Right.
your situation, you may be able to improve your own situation, but the overall system is not going to really change
Not
because of
until we reach enough people that have
right,
improved their own situations
right,
that those people who make those decisions can no longer say, well, just give that duty to the nurse.
right,
She'll figure it out, because nurses are no longer just gonna figure it out.
right.
Mhm.
You're just not gonna have any nurses.
And it's a problem that, like, is compounded by the fact, COVID was just a, like, you know, I kinda I think I've used the analogy, it's like rolling through the foothills towards a mountain of death. Like, we
Yeah.
have we have the largest population that is approaching death, that any of us on the planet have ever experienced. And so it's an inverted relationship. Nurses are peeling off, they're killing themselves or leaving the bedside, and the mountain is getting closer, and we're looking at all the baby boom generation
Yeah.
that who's gonna who's gonna be there for them? Like, that's
Yeah.
And then
terrifying,
those
especially.
that do make it and they are there when it happens,
Mm.
what's the likelihood they stay?
Yeah. Yeah.
Yeah.
I
So
mean, you can only do it for so long, when you're
Yeah.
working short staff like that because they're in a hiring freeze and you don't have enough nurses, you can only do that for so long. And then you're just, then they'll keep hiring, and that's why you keep getting younger and younger and younger, and the 6-month nurse is training the new nurse. That's
Yeah.
exactly how and why that happens. And the public, I don't really think know exactly all of this that goes on either. They think they come to a hospital and they're going to get this high quality standard of care, and it's expected, and they can complain and they're going to get their way and they're always right, and whatever. It's just it's an impossible situation sometimes for these new nurses, and older nurses who haven't realized their value to say no and to do things differently.
and
Mhm.
even those patients who don't trust the hospitals, even those patients who have this mistrust, if you look at what it is they don't trust or why they don't trust, it's still the wrong reasons, because
Mm.
they don't have the information that those who live in the system, because we don't tell our patients.
Right. Yeah.
We're not
No.
allowed,
You're
I'm
not
not
allowed
allowed
to.
to,
Yeah.
yeah,
No,
I
you're not
can't
allowed
go
to.
into the room and
Yeah.
say, hey, the reason that you're waiting 3.5 hours is because there's literally two of us in the building and there are 130 of you guys. We are
Mhm.
doing the best. Like, we're not allowed to say that. So
No.
we cannot reveal the wizard behind the curtain. And
Right.
so that's how you get these folks who think that nurses are intentionally killing people
Yeah.
or not taking care of them and letting them die of COVID, or this
Right.
nurse was malicious and did this. That's
Mhm.
Nobody gets into nursing to be malicious. I mean, I'm sure there
No.
are a
Yeah.
couple outliers out there. There are, but the overwhelming majority of us don't go into it with that intent. So even those people who have healthcare mistrust, when specifically we're talking about they don't trust nurses because nurses are killing patients on purpose or not
Mhm.
doing things to people on
Mhm.
purpose, that's often not true either.
I
Yeah.
Is
think I think the mistrust is more rooted in in the abuse of science. Meaning, how many times have we watched the news cycle yo-yo on whether or not milk is good for you,
Oh,
or
yeah.
chicken, or eggs, or
And that's definitely an abuse of science, because
yeah,
we don't
like,
teach the general lay public to evaluate research.
so
Right.
the confusion that the general public has about what can be trusted in medical science has permeated such a deep level that it's almost inescapable. From I think it's like that is really rooted in the debate between objectivity and subjectivity in my mind. It is rooted in my mistrust of the healthcare system, and just, like, you can't trust, like, you just get to the point where you throw your hands up and say, I can't trust the information that's coming out of this system.
No.
Well, and in some cases you can't, right? So
Y-
the CDC is touted as this organization that is having the public's general interest in mind, but it's also the same organization that told me I could wear a bandana for an airborne disease.
Right.
Mhm.
Right.
Right? So all of science can be manipulated. Data can be manipulated. Statistics can be manipulated, or only this part is pulled out. And there's no general public education on how to truly evaluate that, right? So if I look at this research article that was funded by Kraft, milk is great, right?
Yeah.
The healthiest thing on the planet, no side effects, drink all you want. And in the same scenario, you can pull from the same study and the same data, but funded by somebody who, I don't know, makes orange juice, Minute Maid, whatever. Now milk is terrible and you can't drink it all the time.
So it's claiming to be it's claiming to be objective, but in reality, it's relative.
Well,
that's what you're saying.
I'm saying that when you look at research, the overwhelming majority of the research that the lay public has access to, let's face it, we're all using Google. Okay. You would have to then have the education or the research background to evaluate this study. One, who is it funded by? Two, what method did they use? Is it a method? Did they follow that method? And in their results, are they tying it back to the actual question they're asking? And in their discussion, is it informing that question from an objective standpoint, right? And most people don't even read a whole research study because they're long, they're tedious. There's a bunch of stuff in there that nobody wants to read unless you're a nerd, like who loves this stuff, right? So how do you trust a system that can be manipulated and is manipulated based on funding? Because whoever has the money, like if Kraft's paying me to do a study on milk, well, milk's going to be great because otherwise Kraft isn't going to pay me for that study on milk. So to get that truly objective research is often done in the free realm. It's done by students or people who work at universities who solicit funding through unbiased organizations where the results are the results are the results. The problem that you run into there is if you want to publish open access to where anybody has the ability to look at your research, it may cost you anywhere from $4,000 to $15,000 just to have it distributed out there.
Wow.
So you want to pay me $40,000 or $50,000 as an educator, and then you want to charge me $4,000 to $15,000 to put this on a network that anybody has access to. So most of this research that doesn't make it to the public eye is behind paywalls. And even the stuff that does make it typically has a slant because why wouldn't Kraft want to put it out there on every platform they can get it on? And so there's really good science out there, but we don't teach people how to navigate that world or how to evaluate what is good and what's not. And so they may see this on the news this day and this on the news the next day, and that's all they have to go by.
Yeah.
So how could you expect them to trust that?
Right. Yeah, exactly. Yeah.
There's no way.
Yeah.
So, and if you're looking at somebody who does this for a living, sometimes it's still even hard for me to figure out, are we missing parts and pieces here?
Yeah.
How was this done? So how would somebody who doesn't do it for a living be able to navigate that world?
Yeah.
So, I mean,
it goes deep.
It's a rough world out there, especially if you're trying to learn and you don't have any skill set or background or formal education or informal education on how to do it. What you have access to is even controlled.
Yeah.
How do you get past that? That's why you see milk good, milk bad, milk good, milk bad.
Yeah.
That's why it works that way.
Yeah. Well, I'm so glad that we had you on. This was so good.
Thank you.
It makes me so excited about just the rest of it.
Like where this is going. Like I'm curious to hear, because Brandy, you're the first person that we've had access to that has listened to the podcasts. What are your takeaways from the work that you've watched already, or the content that you've watched, and how can we make it better?
What is really evident, and like and I know, Caleb, we've had this conversation, right? We're going to save the world. So in the way that you guys are presenting this information, that's what it feels like. So there
Right.
is a sense of Caleb and Julie are going to figure out how to, in essence, save the world, right?
Yeah.
So there's this some sort of, I guess the feeling that was instilled was hopeful. Because in my head, I'm thinking, if I could just let these two make decisions, I could go back to the bedside until they kick me in my walker out. Like that could be my dream again.
Wow.
Yeah.
Right? That's what your podcast feels like when you listen to it.
Wow. That's
So that was
pretty
my first
powerful.
thought. That was like, if I could just let these two, how do I get them carte blanche? How do I do that? Who do I talk to? Who do I need permission from? And just have at it. I think the one critique that you could probably start included would be, what are those steps? So we talk about the things, and we talk about what it feels like, and we talk about the journeys that you have, but what are the steps, the tangible things that people who are listening could do to start on the path that you guys have been on? They talk about the big obstacles that you've overcome, but not necessarily how did you take the step one. And how
So that's funny you say that, because I listened to the last episode that we did, and whatever we were talking about, it was like I was talking about this mess. Like it just left us in a mess. And some of the things that we had dealt with, and it was a mess. And I texted Caleb and I said, I think our next podcast should be, how did we start to clean up that mess? Like, what did we actually do? That's super, super interesting that you said that, because that it feels natural to go that way. So like bringing up something, talking about it, and whether we enter into it in that particular podcast or we go on to the next one, the how then. Because I know, like, when I'm listening to a podcast, I do want to know, like, so maybe each one we could do, like, so here's some takeaways. So you could do like this and that. Like the last one, I know, remember, Caleb, I kind of went off on that. You just gotta just notice. Just if you can do anything, just start noticing, and the little things. So that is super good feedback.
Yep, that's the one thing that I wish. So I have more of a history of Caleb's journey just because I know him.
Yeah.
But I was thinking to myself, if this was an interactive thing, the question I would ask would be, okay, Julie, how did we know we got to stop drinking? How did we know? And then how did we do it? What was step one? And not necessarily that it has to be your particular thing, but what are the things that we can give to these nurses that exist in this world already to help get them where they need to be? What's tangible? What can I say to my manager, somebody who's been a manager?
Yeah.
What can I say to convey what I need?
Yeah.
Because we're not taught to do that.
Yeah, no.
Yeah.
Ever. Like I remember after my sister was killed and she died in the very ER that I worked in.
I mean, that's a crazy story. Like, I mean, I feel like Brandy's story is incredible.
Wow.
I mean,
Yes. I came back to work the next week.
Wow.
And I will and I will never forget the manager who pulled me into her office, and she looked at me, she's like, "What are you doing here?"
Yeah.
And I'm like, I gotta come back to work. Like,
yeah,
this is what I gotta do. I got people to take care of. I got a team that needs me. Like, it's not like you have extra staff running around.
Yeah.
And just that mentality that exists, that I could never take more than a week off after I buried my 18-year-old sister because this hospital system needs me.
Yeah.
And why is it so dependent? And she's like, you will get out of my ER immediately, and I will call you when you can come back.
Yeah.
You will stay gone until I say you can come back. And had I had any other manager on the planet who wasn't
Yeah.
a Julie type manager,
Mhm.
they would have just said, okay.
Yeah.
And then
Yeah.
who knows
Mhm.
how the sequelae could have unfolded from that.
Right.
Right.
Well, that's how they're bred. That's the environment that, unless you have the outliers who are, outlier thinkers or, there's a few, but the majority just follow suit and they've never been a manager before, or they're not even a nurse, or you know what I mean? And it's just
Mhm.
like that is the expectation for these
Yes.
nurses to just
Mhm.
come back. There's no mental health. There's no like, I get it. It's more like, do you know that you've been late? You've clocked in, or
Mhm.
you clocked in 10 minutes early or late. Like you get in trouble because you clock in too early,
Yep.
Mhm. Yeah, yeah, yeah.
yeah, those are the kind of things. And so it's the hospitals then take these nurses from these schools and then they they breed them because their breeders were bred
Mhm.
by having to follow what is important, what we care about, what you can and cannot do, what you can and cannot say. Don't talk about that. Don't do that. Don't talk about her. That's not, all of it. And when I picked up a unit and it had just been bred bad.
Yeah.
The nurses who were
Mhm.
teaching the other nurses, it was so toxic and emotionally toxic. It was literally terrible.
And
And
schools
I
do
tried
that.
my best to try to like figure it out, and it was, I mean, that was part of my demise is trying being put in that situation to have to try to do something about it rather than just let these bitches run the unit, you know?
And if you think about it, educators bred students that way, right?
Yeah.
I don't know how many students I've had in clinical, but I can tell you how many colors of socks I have not checked. And the
Yeah.
answer is none. I don't care what
Yeah.
color your socks are,
Yeah.
Yeah.
right?
Yeah.
None of
Mhm.
that matters. But I would say that in education, I'm the exception.
Yeah,
Mhm.
I
People
would too.
want a pressed uniform, they want white socks. I expect this, this. Here is
Yeah.
this box that I'm putting you, and I expect you to be in it and perform. And white socks in clinical for nursing education is the same thing as that stupid whiteboard in the clinical practice.
Yeah. Yeah.
Mhm.
It's almost like a deterrent. Like they're trying to deter nurses from feeling, thinking, seeing, experiencing what actually is going on
Yes,
by pointing to this and this and this and this and this and this and this.
there is the most narcissistic
Yeah.
relationship you will
Yeah.
ever be
Yeah.
in.
Yeah.
It
Yeah.
is.
It really is.
Healthcare is the most narcissistic relationship you will
Yeah.
ever be in. And let me tell you, their gaslighting skills are top
Yeah.
notch.
Yeah. God. And that's why that's why, not every nurse who is gaslit by the healthcare system is going to commit suicide, but you don't know who will.
Right.
You don't know who's going to affect because we're not robots. We're humans that have come into with lots of different grown-up stories and emotional fragility. And you don't know that, if you're that particular time that they're reprimanded isn't gonna be that time. That
Well,
they're just
and
like, "I'm
even
not
if
worth
they
anything."
even if they don't get to the point of suicide,
Yeah.
the journey along the way impacts who they are, how they are, and
Mhm.
how they care for people. So even if they're never pushed to that point, they're going to leave, or the things that they do are going to have that negative impact or negative connotation along. There's no escaping
Yeah.
that being a negative thing, even if they don't get to the point of suicide.
Mhm.
It's
Yeah.
negative along the way, the whole thing,
Yeah.
start to finish. And it is, I don't know of another way to fix it other than
Yeah.
empowering nurses
Yeah.
Mhm.
to speak up and say something about it. Because,
Yeah.
like everything in healthcare, nothing is going to change unless the nurse does it.
Right.
Yeah.
Yeah.
That is so
I
true.
mean, really.
I mean,
So
isn't
true.
that what we're all isn't that
Yeah.
what we're all 3 doing here?
Yeah.
Like you,
Really.
Brandy, you in your way, you're just, "Okay, I see the problem. I'm
Yeah.
gonna do my little part to fix it."
Yeah.
Yeah. To
And
the
that's
point
what
where,
we're just
like,
picking it up and okay, we're
Yeah.
going to do this.
As I have said, healthcare and emergency medicine became this was just something that I don't think I could have loved anything more.
Mhm.
And this system changed it to be unrecognizable
Yeah.
to where I had no problem walking away from it, which is something
Yeah.
I thought I
I
would
know.
never be able to do.
Same.
Yeah.
Same.
So,
I could have never not see myself be ICU. I mean, I would have done it. I would have done it. I just would have done it. But
forever.
yeah, it
They'd have
just
drugged you and your walker off the unit.
yeah,
Like, that's
exactly.
just how it would have been. And
Yeah.
so I don't know of another way
Yeah.
other than changing those that are going into it to not
Mhm.
accept
Yeah.
this.
Yeah.
Yeah.
You don't have to accept this. This is what your value is.
Mhm.
And I just literally tell them, show me a hospital in the country that doesn't need a nurse.
Yeah.
Oh, wait, go ahead. Google away. Look,
Yeah.
that's what your value is.
Yeah.
Demand it.
Yeah. Demand your value. Yeah.
Demand it. They'll pay it.
Yeah.
Now it's going to be painful. Trust me, it's going to be
Yeah.
painful.
Yeah.
And you may have to figure out how to find that unit or how to find that hospital or how to find that clinic or how to find that outpatient
Yeah.
this or whatever it is you do, because it's going to be a needle in the haystack right now, but if enough of us keep doing it, it will not be a needle in the haystack
Yeah.
anymore.
There will be the outlet. There will be the standouts. There will be the places that then now have become like, this is where you want to work.
Uh-huh.
Yeah.
This is the environment that we want. This is
Yeah.
what we demand. Yeah.
And nursing is a small world. The word will get out.
Well, this was awesome.
So awesome.
It was
Thank you,
cool.
Brandy.
Yes,
Yeah.
I
I
appreciate
love
it.
you both so much.
Yeah, so much.
You know, I love your face.
I love your face. Oh man.
Never in my life been more fortunate to have a vote on who gets to join our PACU team
Mhm.
Oh,
than our vote for Caleb.
it was pretty awesome. The way that they interviewed me, that my first nursing job back after going through tremendous
Mhm.
crisis and rock bottom. You know, I was very honest with where I was coming from, and you know, it was the whole team, everyone that worked in that PACU. They set up a horseshoe style. They set up all the chairs. I came in, I sat down, and it was the entire team that I'd be working with, and they all asked me questions, and we just had the best time.
Mhm.
I said, I'm scared. You know, it's been a long time since I've practiced. And, you know, I think the thing that I said was my number one concern is that you won't let me hurt someone.
Correct.
That
Yes.
I'm out of practice and I need you to walk me back into this and make sure that I'm safe.
Mhm.
That is exactly what he said.
Yeah. I was just terrified because, well, I mean, Julie was there, you know, she was there when the doctor abandoned me and I lost that patient, and I lost my confidence that I was capable of caring, that I was capable of nursing.
Yeah.
It destroyed me.
Yeah.
So, and that really informs, I mean, Brandy, you know the whole story. I
Mhm.
told you probably some late night in the PACU on
Yep.
call.
Yeah. 3 in the morning, we're waiting on a hot appy to come out, and we're just like, oh, look
Yeah.
at this world.
Yeah. Right.
Those are some of the best times though.
Yes.
Oh, great.
Yeah.
So great. Yeah.
Yeah.
So great.
It was very refreshing to have somebody who was wildly aware of where they were. And let me tell you, he underpromised and overdelivered.
Yeah.
He got right back on that bicycle like it was nothing.
It really was. It's remarkable. Yeah.
Yeah, he made it seem like we were going to be over there like, this is a patient, Caleb.
Yeah. Right.
Lift him up.
Yeah.
You know, but it was very cool to witness that getting back on the bicycle and seeing how natural it was for him and how just this is what you're supposed to do, man.
Yeah.
This is what you're supposed to do. And
Yeah.
that evolutionary journey of just coming back into it
Mhm.
Yeah.
in a way that doesn't break you.
Yeah.
Yeah.
Mhm.
Yeah, that's great.
That's cool. And I'm
Very
beyond
cool.
honored to have been a part of it.
That's
Oh,
nice.
A very small part, but
big part, big part. We hope you've enjoyed this week's episode.
Remember, the conversation doesn't end here.
Keep the dialogue going by connecting with us on social media posted in the links below or by visiting our website.
Together, let's continue to redefine nursing and shape a brighter future for those we care for. Until next time, take care, stay curious, and keep nurturing those connections.
And don't forget to be kind to yourself.